Tonight in Medical Rounds, we're shining the light on suicide prevention. This after the tragic death of actor and comedian Robin Williams earlier this week. And joining us live tonight is Dr. Harold Schwartz, psychiatrist in chief and vice president in behavioral health at the Institute of Living and Hartford Hospital. Doctor, thank you so much for being here tonight.
Thanks for having me.
So many, I think, are so perplexed how someone like Robin Williams could take his own life, someone who seemingly had it all, loved to laugh. How do we know if a loved one could be suicidal? I mean, do most people show warning signs?
Well, first of all, it's important to say that depression and suicidality cuts across all spectrums of life. Nobody is invulnerable to it. But clearly, the majority of people who commit suicide are suffering from very severe depression. So the signs and symptoms of depression are the things that we should look for, and that is, feelings of sadness, withdrawal from life, loss of interest in things, difficulty sleeping, loss of appetite, disengagement. These are the cardinal signs that somebody may be suffering from a severe depression and really would call for an intervention that leads to treatment.
So if you're listening and you or someone you love feels depressed or even suicidal, what do you do to get the help you need?
Well, the first thing to do is to talk about how you're feeling. Share how you're feeling. Don't keep it bottled up. It's important that your spouse, your loved one, or some members of your family know what's going on so you're not left entirely to your own resources. In terms of getting help more specifically, a good place to start is with your primary care physician. Sometimes the primary care physician, him or herself, can be very helpful, but most often can be the source of a referral to an appropriate mental health professional so that you get yourself into treatment. If you find yourself in some urgent situation, you can always, in the state of Connecticut, dial 211, which is a hotline right there for you in Connecticut that will steer you to help, or go to a hospital emergency room.
All right, definitely want to take those signs seriously. Dr. Harold Schwartz, thank you so much for being with us tonight. We appreciate that. And we want to remind you that World Suicide Prevention Day is on September 10th. There's also a special seminar happening on September 23rd. It's called Cracked Not Broken. A suicide survivor will share his experience and insight. For more on this event, you can click on our website, WFSB.com.